Hello, everyone. This is Andrea Fava coming to you from the beautiful city of Barcelona at EULAR 2025. And I'm going to talk to you about a beautiful session that wanted to explore what's beyond B cells in terms of lupus pathogenesis, especially focusing on myeloid cells. This was a session presented yesterday, and it was a lineup of three speakers, wonderful speakers, at least the first two. The third one was me. The first two were Michelle Kallenberg and Virginia Pasquale. And Michelle Kallenberg gave a beautiful presentation speaking about how myeloid cells, and just for reference, these are the cells that are immune cells. These are not lymphocytes. So they include monocytes, neutrophils, dendritic cells. And she focused on the skin. And what she showed is that these myeloid cells that are absolutely critical to mediate inflammation in the skin in lupus, they they can get their education in the skin, and then they go in the blood and they can cause trouble. What does that mean? It means that there are immune cells that they circulate in the blood, they go about their business. And then if you have skin lupus, these cells are attracted to the skin, and there they find an environment that generates a phenotype, which is a modification of the cells that give them their identity. And then they can go around and they can cause inflammation, especially in the skin and in other organs. And these cells that are in the myeloid compartment, especially, there seems to be dendritic cells, especially with dendritic cells. They go in the skin and they get information and they get signals from all sorts of skin cells, keratinocytes, fibroblasts, and other myeloid cells and non-myeloid cells. They get their education there, they acquire this phenotype, and then they can go around and cause trouble. And how is that triggered? Well, there are multiple things that can trigger this mechanism. And she showed how their data, their mechanistic data, showed that UV exposure, so sun exposure, infection, and other sources of injury can induce this phenotype. And so this is important because it's giving us more ideas about, more insights into the mechanism that generate the type of immune cells in lupus. And so as we understand the mechanism, we can learn how to undo the process and block the process and develop better treatment strategies. The second talk was a phenomenal talk from Virginia Pasquale. And then she was focusing about the role of interferon and interleukin-1. And what she has shown, well, she started from the concept that so she's a pediatrician, there are genetic components of inflammatory diseases, and there is a particular category of diseases called interferonopathies. That are autoinflammatory congenital diseases that can cause a lot of interferon secretion and activation, and lupus actually can be quite classified as part of that given the interferon signature. And traditionally, we think that type 1 interferon and interleukin-1, which is one of the master cytokines of inflammation causing fever, they tend to live on a balance, meaning that when you have one, that regulates the other. But they found that there is a subset of patients and actually cell types in which they were surprised to find both an activation of type 1 interferon and interleukin beta. And that was totally unexpected. And so they dig deeper. And to make a very long story short, they published a few years ago that this is a phenomenon that seems to be triggered by red blood cells that retain mitochondria. And mitochondria are not supposed to be in red blood cells. Mitochondria, this is some sort of a million-year-old feud, because mitochondria are derived from this, prokaryote organelles. And then when they are exposed and the immune system sees them, get very triggered by seeing this kind of foreign material. And so when there are antibodies targeting the red blood cells, the myeloid cells can really engulf these red blood cells. They get to see these retained mitochondria. They get very angry. They secrete interferon. And one of the molecules induced by interferon, part of the interferon signature, is called MX1 or MXA. And they found that this MXA makes this kind of cylinders. They're like channels, and these channels are critical to induce the release of interleukin beta, which is coming from the inflammasome, and that can cause additional inflammation, which is a totally new mechanism And that may have implication for some of the manifestations of our most more inflammatory lupus patients. Absolutely fascinating. The final talk was about the role of myeloid cells in kidney. And in this talk, what we reviewed is that myeloid cells, despite, we know that by blocking B cells, we can have a therapeutic impact on lupus nephritis, but myeloid cells are truly some of the mediators. And they work in two ways. One, when immune complexes are deposited in the glomeruli, these attract neutrophils and monocytes and macrophages, which cause the initial wave of inflammation in the glomeruli. And that is what is very active in class 3 and 4 lupus nephritis. This is usually what we treat with steroids to get rid of them quickly, because they can release granules. These are kind of hand grenades released in the contained space of the glomeruli. It can cause a lot of trouble. But then there is a second group of myeloid cells that we found in the tubular interstitium, and these are the macrophages that are supposed to be there to clear the injured tissue, apoptotic debris. But these cells, when they stay around for too long, they do stimulate fibroblasts. They are pro-fibrotic, pro-scarring, and these are the cells that eventually induce the chronic changes in the kidney that lead to kidney failure. So, and that was all a talk showing how the newer technologies, such as spatial transcriptomics, spatial proteomics, are really giving us a very fine immune map and the landscape of where these cells are, who they are next to, and what do they do, which is opening very exciting avenues to better understand lupus nephritis. So altogether, these three talks showed how these myeloid cells are. We're getting more and more familiar with this innate immunity, how that is important, how it mediates disease, and hopefully giving us insight on how can we target these cells to prevent damage and treat acute inflammation. Very exciting. The pipeline is incredible. And if you want to learn more about this, please go to room now.